We can go ahead and advance to the open enrollment slide, which should be the third one. So go ahead and advance, I think, 2 slides. All right, so in your packet, well, let's start here. Okay, open enrollment for the retirees is the entire month of November. And your packets should be arriving before the end of the month. We actually got everything out and ready to go, which is why I was able to bring our rate sheets with us. In the packet, you're going to have a letter that's going to compare your 2024 rates to 25, and we'll also have an enrollment form for you to fill out and submit to us. If you don't receive a mailed packet by November 8th, please do check or call in and let us know that you haven't received it. And another thing to note is if you had elected for electronic communication, your open enrollment information will come to you with an email notification or a member direct emailed notification that your enrollment information is ready for you. So if you don't see anything from member direct or the packet, please do call the health team at the Office of Retirement Services and we will replace the packet for you. So open enrollment is your opportunity to make changes to your current insurance elections. The changes, they can include adding or removing eligible dependents or changing your medical provider or even changing your plan. So say you're on the Delta HMO plan for dental and you decided you want the PPO plan for this year. That is the opportunity during open enrollment for you to go ahead and make those changes. So forms with your 25 elections must be received by our office by November 30th in order to make these changes. So please do make sure you get those in on time. And again, the electronic submissions through member direct are immediate. The other ones you'll have to mail in for us. So for those of you who are currently enrolled in medical or dental in lieu, your annual re-enrollment is required. So make sure you submit the forms. If for some reason you don't get a packet and you know you had health in lieu at one point in time, make sure that you call the office to find out why you didn't receive a packet, because if you're not enrolled in anything else, it won't generate anything because we're not showing you enrolled in the system. So again, medical and dental in lieu, it's critical that you submit those packets or submit the form to elect those annually. Another way you can submit, again, is through member direct. There's check boxes on there. Make sure that you check all of the little boxes that say, I accept this, because they're kind of at the bottom of the sections and people forget those and then it doesn't submit. But once you've successfully submitted your form to us, you'll receive an email notification letting you know that it was successfully submitted. And if any of you still have dependents that are over the age of 18, and you used to submit the full-time student paperwork to us so that we can verify that you had a full-time student enrolled. We changed that a couple years ago, but what some members didn't recognize was that they needed to re-enroll their children or their adult dependents. So if you have anyone that is, again, over the age of 18 and you're not sure whether or not you re-enrolled them, make sure you submit a form this year. They can stay enrolled in the medical plans and the Delta HMO plan until age 26, and you can stay on, or they can stay on the PPO, so that would be the dental PPO or VSP until age 24. And again, all the changes that you submit to us are take effect January 1st. We'll go ahead to the next slide. All right, the good news for 2025 is there's no changes to any of the carriers. So we'll still have Anthem and Kaiser for medical, Delta for dental, and VSP for vision. Go to the next slide. Thank you. So some of our key plan changes for 25 is the IRS has increased the deductible thresholds for the high deductible HMO plans. So if you elected that, your deductible maximum threshold you need to meet for an individual plan is $1,650 and $3,300 for family. There have been some changes, as Jim indicated at the front, to some of the formulary stuff, but another Kaiser change specifically is for the GLP-1 medications. These are the meds that are typically used to treat diabetes and have been in short supply. So they are requiring physicians to only prescribe them for diabetes, or if you have a diagnosis for morbid obesity. So they will not be used for just designer weight loss type applications. So you can't just go in and ask, have my Ozempic or Wegovy, I think is the other name brand that people have been asking for. You have to have a morbid obesity diagnosis to utilize that medication for weight loss. And then the last thing that is Kaiser changed for Medicare, they have decided to retire the Silver and Fit program and are introducing a One Pass program. The One Pass is a more enhanced system And if you want to go ahead and flip over to the next slide, there's some key things on the slide about OnePass. You will have access to more gyms. You have access to some boutique gyms in addition to all of the Ys are now included. That's an enhanced service. So they have both the core and their premier service. We have access to the premier service. So it is definitely an improvement over the Silver and Fit that they had. If you're going to one of the gyms that they have, there's a map that you can select your area and take a look to see where it is. And you decide that you're not happy with that gym that month, you can change gyms every month if you really wanted to. Other things that are included are some online fitness stuff, so you don't have to leave your home. And there's also some exercises like Sudoku and things of that nature that are specifically designed for cognitive development and to make sure that you keep your brain active. Okay, so on that, we're going to move along to the next slide. Some Medicare changes. We had the Inflation Reduction Act, which changed the out-of-pocket maximum for prescription medication from $8,000 down to $2,000 for 25. So that's a significant reduction. The other thing that they have asked is for the carriers to introduce a payment program so that if your medications are on the expensive side, you hit your $2,000 threshold, you have difficulty paying that back, you can now make payments on that. So Kaiser will be self-administering their program, and Anthem is partnering with a company called Simplicity RX. It is an option, it is not a requirement, so it is something that you have available to you if you need to have a payment plan. Okay, so the next slide. All right, still on Kaiser. Kaiser is opening a new medical office in Salinas. The medical office is going to be for non-Medicare members. It'll have all the same services that you have at your typical Kaiser facilities. That is kind of the way that, let me back that up. The reason why it's solely a non-Medicare facility is because Medicare has specific requirements in order to become a Medicare facility. So once they're up and running and get themselves established, they'll revisit whether or not, Medicare is authorized to be administered through that medical facility. So again, Salinas will have an office. And then the next slide is also going to show that they are expanding their services into Monterey County. So if you can go forward, there we go, perfect. It's an eye test right there, but there are various areas here that are in these Monterey County that will now have Kaiser facilities beginning January of 2025. So I don't know that all of them are going to be open as of January 1, but we're being told that in January, early 2025, there will be facilities in those areas. Don't worry about memorizing this. You can always contact our office if you are in that area and you want to find out if you have a facility near you. There are zip code requirements to participate. So the zip code lists are also available on our website. But again, a member of my team can help at any time to answer questions that you have. All right, moving along. So we're going to now talk about rates. This is always the fun conversation that we have. So the next couple slides are going to concentrate on our rates. Excuse me. Allergies, they're fun. Non-member plans have increased between 5 to 6.8%. Anthem rates have increased by 5% for both their HMO and PPO plans this year. And as you can see, the Kaiser range is the one that varies between the 5 and the 6.86%, depending upon what area you live in. So our Hawaii and our Pacific Northwest have a little variance as well. So go ahead to the next slide. Medicare rates for both Anthem and Kaiser have also increased, and you'll see that the Hawaii and Pacific Northwest actually have decreased, believe it or not. Thank you so much. The California increase is directly related to a planned phase in increases that have been imposed by the Centers for Medicare and Medicaid Services, which we affectionately called CMS. So if you call our office, you'll hear us reference CMS a lot. The good news is for Medicare, we are continuing to subsidize the entire cost of Medicare. So you're not paying anything out of pocket for your premiums for Medicare, but you do have to pay your Medicare Part B directly to Medicare. So one of the things that I can't stress enough is to make sure that you stay up on those payments, because if for whatever reason you missed a payment, you forgot, something didn't go through automatically, the folks at Medicare are not forgiving. They will just terminate your coverage. And if your coverage is terminated because your B has not been paid for, that also means you lose your city coverage until that gets resolved. They are not quick to resolve these things, which I'm going to be very candid, really sucks, because we try everything that we can to try and get you back on the plan as quickly as we can, but we're at the mercy of Medicare. So if for some reason something hiccups and your Medicare Part B payments have not been made, remember to resolve that as quickly as possible, because you will have a gap in your coverage for medical. You are required to have Part B as part of your Medicare so that you can go to do your physician visits. So if you have doctor visits, you have Part B. Part A is your hospitalization. Okay. All right. I think I covered everything that was on that slide. So changes in the medical rates, which is this colorful thing that again is an eye test. It's the same stuff that they were telling us last year that has influenced the increases in rates. It's a lot of folks during COVID decided not to seek preventative care. They are having labor shortages. We've got inflation. The overall cost for prescription medication and providing services have increased. So unfortunately, they passed that cost on to us. And luckily this year, our consultant was really, really aggressive in negotiating with Anthem. They had wanted close to a 15%, I believe, increase when they first told us about our rates. And they negotiated that down to 5%. So that was great. And again, that's the non-Medicare plans. The Medicare plans are a little different again, because we have the Center for Medicare and Medicaid kind of just dictating their phased in fees. So we go ahead and go to the next slide. So this is the fun thing for me for this year. I have rate sheets. Normally about halfway through October is when I'm getting everything finalized and entered into the system. So I'm really, really excited to tell you that we have rate sheets. We do have them here with us today. And our open enrollment website is now live. So you can go to the open enrollment site when we're done with this meeting. You can look at the rate sheets. You can look at the summary of benefits, plan comparisons, and all the information that you need to make an educated decision for what you want to enroll in. So what we have on this slide, which I'm going to have difficulty reading because it is small, and that I will explain, and I'm sure you're not going to be able to see either because it is tiny, and I apologize for that, is that the way that the rates are formulated, we mentioned, a 5% or a 6.86% increase. That is the general increase to our rates that are imposed, if you will, from our carriers. The way that it gets extended to you is all based on what the lowest cost plan is at that level. And our lowest cost plans always seem to be the high deductible plan from Kaiser. So on the rate sheets, and you can kind of see sort of in the top left corner, there's that bluish box. This is the member only rate sheet. You'll see it says member only, and then there's a number to the right of it. That is the lowest cost plan for this particular coverage level, which is the member only. So you'll look in, I know you probably can't see how, can anybody see these numbers? A little bit, huh? Perfect. All right, so in this instance, and I'm gonna try not to, I hope that mic will get me. The lowest cost plan for the member only is $637.74, which again is the 3,000 high deductible HMO offered by Kaiser. So that particular plan, if you select that, you have no out-of-pocket expenses for your premium. I will qualify that. You still have prescription and some other things that you'll be paying direct to Kaiser. But what that translates to in our more expensive plans down here, which is our PPO for our nationwide plans, you'll see that we'll take, for instance, the $100 deductible classic PPO. When you take the total premium of the $3,014.62 and you remove the $637, you're left with a balance of $2,376.88. That is the monthly premium that the member pays to have the Kaiser PPO plan at the $100 deductible. And that is an increase, because I have my 24 rates over here, of $102.66. So if you were to pull out a calculator and look at all of the numbers that I have up there, and you look at the Anthem range, it's not a 5% increase again, because it varies based on what that lowest cost plan is helping to subsidize. So that's why the rate sheets are a little confusing. That's also why it takes us some time to generate them. So even though we get the rates from the carriers, it takes us a lot of back and forth for roughly a month before we can finalize those rates. But they are here and they are ready for you to take a look at today. Again, either on paper or the open enrollment website, especially for those of you on Zoom. You can go to the San Jose Retirement Services website and click through the banner. It has the open enrollment link and link over. And then later on one of the slides, you'll see the open enrollment website itself. So if we go to the next slide, I also brought in member and spouse. I will point out again, you know, Anthem had a 5% increase, but curiously enough, this one here, the $1,500 deductible select HMO, again, because there is $1,275.48 subsidized, actually goes down by $2.06. So it's, again, confusing. I say it's a 5% increase, but some people will experience 5%, some may experience more, some experience a lot less. So pull up the rate sheets, see what you are enrolled in currently, and you can compare for 25. We make it easier for you once you receive your packet because that math is already done and you'll see what those increases are. So it'll have that in your open enrollment letter. All right, moving right along. Let's see, trying to see where we're at. Changes in retiree medical rates. So we do have continued increases on our medical premiums, and it's especially, as you know, we have for our out-of-state members. So let's see. Yep. Okay, good. This is what I wanted to see. So Jim had talked about, or Ray had indicated that Jim's meeting monthly with the city, because what we've done is we've put together a committee that is comprised of human resources, our consultant that helps us negotiate all of our health plans, and other active city unions. And we're coming together to discuss the challenges that we have all had and what have been voiced, especially for our members that live out of state. When you move out of state or you move out of a Kaiser service area, you only have Anthem PPO. And that Anthem PPO plan, as you saw, is really expensive, especially if there are still families out there with children. It's almost at the point where it's literally unaffordable. So one of the things that we are really concentrating on and trying to influence is what other options do we have available to us? Do we need to stick to this Anthem PPO plan? Is there something that we can do to maybe introduce a nationwide HMO plan? So do keep in mind that we are very aware of the challenges that have been faced, and we want to make sure that we're doing our very best to provide you with services that are affordable. So stay tuned on that one. We've only had about, what, 3 meetings so far, Jim? 3 meetings. So we are intent on still coming together, finding out more information and studying this problem so that we can offer up some solutions for City Council and our city manager to grapple over so that we can make things more affordable. And with that, I think I'm transitioning over. Am I transitioning over now to Tram? So Tram is going to continue our conversation about Medicare, and I'm going to step aside.
Larry, were there any questions from? No, not yet.
Not yet. Okay.
Perfect. Hello, everyone. As Teresa mentioned, my name is Tram. I am a health analyst with Retirement Services, and today I'm going to discuss the Medicare mandate. For members who have recently turned 65 or will be soon, this is a reminder that as defined by our municipal code, all retirees are required to enroll in Medicare Parts A and B. As Teresa had mentioned before, we do have many members that experience loss of their Part B when they are in Medicare. So we like to emphasize the importance of making sure that your premiums are paid monthly so that you don't lose your Medicare, resulting in a loss in coverage through Retirement Services. And so Retirement Services sends letters to those eligible prior to turning 65 with enrollment instructions. And there are strict guidelines around Medicare enrollment. Once you turn 65, there is only a 3-month grace period to enroll. So if you miss the deadline, you will have to wait until January for the annual Medicare enrollment. And if you are not enrolled on time, you do risk losing your health coverage and may incur penalties assessed by Medicare. And to help members be as prepared as possible, RS does partner with Kaiser to host quarterly Medicare workshops. We do have flyers on our table, which will provide you with information that is required by Medicare, what is required by us, Retirement Services, and what the Kaiser Senior Advantage Plan covers. So keep an eye out on the website for future workshops, or you can also grab a flyer on the table in the back. Next slide, please. And here we also have our wellness options. So all plan members, if you have Anthem, you can download the Sydney app. And if you have Kaiser, they do have different apps. So we have the Calm app for meditation. We have Ginger and then My Strength for Kaiser. And you can access your health insurance information right on your phone through both of these apps that are available on your smartphone. Next slide, please. Okay, and Medicare wellness options. So Anthem Silver Sneakers and Kaiser's now OnePass are continuing in 2025. So program details can be found on the additional benefits tab on the Open Enrollment website. Kaiser Medicare is continuing their Kaiser's Meals program, which is available to members after having been hospitalized or treated in a skilled nursing facility. Members can select no-cost, fresh and healthy meals to be delivered to their homes, and this benefit provides 3 meals per day for up to 4 weeks, for a total of 84 meals per calendar year. Also continuing in the Kaiser Medicare Transportation Program offers 24 one-way trips to and from your doctor visits at no charge. These and other programs and benefits are located under the additional benefits tabs on the Open Enrollment website. So please visit our website for more information and more benefits that you can access from our vendors. Next slide, please. And we have our annual health fair coming up on November 6th, which will be over at Leninger Center in the Okayama Room. For those of you not familiar with Leninger Center, it is located next to Happy Hollow Park and Zoo, and parking passes will be distributed for free parking. If you didn't make it last year, we strongly encourage you to join us. In addition to the various health carriers, we have wellness vendors returning. Come enjoy a massage, get a fitness assessment from Stretch Lab, get screened for sleep apnea and discuss snoring solutions, or just grab a sample of yummy freeze-dried snacks. And we will also have food trucks as well from 10 a.m. to 2 p.m., as well as our Medicare workshop from Kaiser at 1 p.m. And don't forget to visit the Retirement Services bake sale for snacks to keep you going. And lastly, flu shots. It is that time of the year that everyone should be getting their flu shots to keep up our health and wellness. Okay. And next slide, thank you. And lastly, if you need assistance with claims from any of our providers, this is the information that you will need. We will have this information on our regular retirement website as well as our Open Enrollment website. But other than that, that concludes our presentation for today, and we are going to open up for questions. Yes.
Okay, on the question, there's a second delay between what's going on, so ask the question, get it out to everybody, and then we'll go ahead and get an answer, okay? Yeah. Hang on a second. Thank you. You said there was 24 one-way trips. It's been you also said round trip. Is it one-way or round trip?
So it says, oh.
A second.
Okay, so there's a question from the floor about whether the 24 trips back and forth to doctor are round trips or single trips. And she's going to answer that by saying?
They're up to 24 one-way trips, up to 50 miles per trip.
So that looks like you get 12 round trips.
Yes.
Once a month. Once a month.
Per calendar year.
Per calendar. Well, yeah, but it's once a month, but it's per calendar year. Yes. Okay. Any other question?
Any other questions? 21, 25. Okay, so the Silver and Fit's gonna change over to the OnePass.
Correct.
Do we need to call Silver and Fit and have them change us over to that, or is it gonna be the same organization within Kaiser? Okay. No.
I have to be back here apparently.
Okay, everybody, the question from the floor was, this new OnePass has come in. Does that mean I need to re-enroll, or am I going to be enrolled seamlessly from what we have now into one pass? And the question, and the answer is,
Unfortunately, I don't know. I do have the One Pass flyer currently posted on our open enrollment website. It has some more plan details. I am going to make an assumption, which is always a bad thing to do, that Kaiser does have a plan that you will be able to transition in. But again, there is access to so many more gyms that you're probably going to want to take a look at least the One Pass to make sure you're selecting what you need. And since Kaiser's no longer paying the folks that administer Silver and Fit, my guess is going to be they're just going to drop you and it's not going to be an issue. But if that is incorrect, I will make sure that we qualify that and add additional information to the open enrollment website so that that is crystal clear for everyone.
to tell you the truth, my experience with Kaiser is that you're gonna have to re-enroll, come up with a new password and all that kind of stuff when they have these new programs. So if you go right now today to try to get in, you probably are not gonna see it until January 1. So let's not everybody go crazy. These new benefits are only gonna be available probably by January 1, okay? That's gonna be the important factor on that.
Okay, folks, I hate to do this to you, but I have to run over to SJREA to do this exact presentation. So Tram is here to continue answering your questions. And if we run into something that we're not able to answer today, she can take down your contact information and we'll be sure to get you that information. So thank you so much for your time today. And I'm gonna hand this off to Tram.
Any question over here? I'm having a PPO, anti-PPO Medicare with the last, which is started. We never had to do anything. We just let it go. Is that still true?
Yes.
No extra spot.
Right.
Okay, so the question is, do you have to do anything to change your plan? If you're on a plan right now, what's gonna be when enrollment comes around? And the answer is,
So the question specifically was, he is enrolled in Anthem's MAPPO with his spouse and is currently having a $0 premium monthly from Retirement Services. That is still the case. And again, we do have our rate sheets for 2025 available on the table. But I can guarantee you again, 0 premium for 2025 for member and spouse Anthem MAPPO.
it's still gonna be the same way, folks. You're gonna get a letter from Retirement Services that says, you have this, you have this. If you don't wanna change anything, you don't have to do anything. If you wanna change, that's the important part. One of the things for some of you that have Anthem, you might look at how much your healthcare costs are right now, and you might, if you're not 65, you may wanna look at changing to something that has a lower deductible, lower copay, et cetera, because there's ways you can save money if you actually go out and look at the plans yourself. And that's real important. And that's why the health fair is kind of a good place to go, because you can get some of those questions asked if you do your homework before you get there. So that's to those pre-65, do your homework. If you can't go to the health fair, you should get a lot of things answered. Another question, anywhere in the house? Okay.
Can you start by issuing some sort of a warning at the very beginning? People on Zoom didn't hear that. Start with whatever.
Yeah, I will.
That's all I'm saying. To do
Oh,
that.
okay. For those of you, when I started was,
You're over here real quick.
when we started the presentation, I said that you should have received this booklet. Timmy, zoom in on that, will you? If you can. You should have received this booklet from the government about Medicare. It answers all the questions about Medicare. It's really good. And like I said to everybody else, when you open the book, it's got big printing, so you could probably read it without your cheaters on and make something worthwhile. But this will answer all the questions about Medicare, because this is the Medicare program booklet that goes. The other thing I think was already alluded to, but we'll go over it again. Most of you should have received in the mail this is just a flimsy piece of paper, but it's so important because it talks about the formulary. It talks about, what's the formulary? That's your pharmacy. A lot of times pills change names. A lot of times the pharmacies will no longer carry it. And so if you have something like that, you need to go in and make sure that before January 1st, you know whether your medication is going to get refilled the way it is. If it's not, start talking to your doctor and find out what the substitute is or what you can do to make sure that you have your medicine come January 1st. Is there any questions from the floor? Otherwise, we're going to turn it back to Ray. Oh yeah, Delta. Okay, yeah. Go.
This one is taking, group for negotiating the Kaiser, $70 quarterly benefit. Will it continue in 2025?
Yes, so the question was for Kaiser, there is a $70 over-the-counter quarterly benefit that you can use online. And yes, that will continue in 2025. However, you must use it online. So you have to create an account in order to access those credits. Unfortunately not.
No, and
Anthem does not have anything like that. The Medicare, the Medicare Advantage PPO. Card says Medicare Deferred PPO. I pay zero. Who says Advantage is zero? Pretty different. What's the difference terminology wise?
So for those on Zoom, the question was, the Anthem Medicare Advantage PPO versus on the card, it says Medicare Preferred PPO. It is just different verbiage on the card, but they are one and the same. So there's no difference.
any other questions? Dustin.
Well,
Make the question short, gang, especially on Zoom.
I'm just gonna read it out.
Go.
Last year, split plan, but there were problems for retirees on Medicare and spouses not yet 65.
That's
So we now have an Anthem Medicare PPO and spouse on Anthem HMO. Is that going to be possible this year, or do we both have to be on the same plan?
Okay, so there's a question about split plans.
On the split plan, because I'm there, my wife's not 65, and Anthem and I do HMO as my senior advantage at the time, because my wife was HMO. Anthem changed that last year and said, no, there's too many problems. It took me 6 months to get my doctors. Okay, that was crazy. And every doctor I had was the ones I had originally said, oh, we don't take the HMO for seniors, for Medicare. Yeah, they do. They just didn't realize they did. So Anthem, thankfully, said last year, we're doing a split plan, and the split plan will include PPO for the spouse. And that's where we're still at, I believe.
Correct. Yes.
Yes, and that's where we're still at. So it will be a split plan, but we won't have an HMO for Anthem. You'll have a PPO. I had to go to PPO. I was HMO. I now am PPO, zero deductible.
Yes, to further clarify what Ray is indicating is we discontinued the Medicare HMO, and now we have commercial plans, non-Medicare HMO and PPO, and you can split that with the Medicare PPO. So for Medicare, it's a PPO only plan. For non-Medicare, we do have the HMO available and the PPO, and you can still do a split plan with a non-Medicare HMO and a Medicare PPO, or both be on PPO.
So the bottom line for everybody is you've got to do your homework. The rate sheets are there. If you go to the website for retirement services, it has a lot of explanation about what's going on. So that's the important part. Dustin?
Good.
Okay. All right. We're done with the questions from out there. Anybody else have any questions about specifically what Trent's been talking about? Okay. Thank you very much.
All right, thank you.
Thank you.